And this is Last Chance Surgery. Tonight...
Her name is Georgie. I got from Peace Wales Hospital.
Shannon is only 9, but has had 15 brain operations.
Every day is special, and every moment with her is special.
Now, little Shannon needs Dr Charlie Tio to save her life again.
You either accept death now or you offer her a last chance of surgery.
Kimberly got the operation to keep her alive.
Put it this way, if she got the flu, she wouldn't last a week.
Now we follow her recovery to see her biggest test yet.
I have new lungs. I have a new life.
And Claudius is going blind.
This eye is the worst one, doctor, on the left.
If we don't do the operation, you would go blind.
Now Claudius must decide whether to have remarkable surgery to save his eyesight and his life. Shannon is an outgoing little 9-year-old. She loves her teddy bears.
Her name is Georgie. I got her from Peace Wales Hospital.
Almost as much as her rugby league team.
Go Jamal!
Every day is special, and every moment with her is special.
That gentle smile and the sparkle in her eye gives no clue of what this little girl has been through.
Before Shannon was diagnosed, I thought life was close to perfect.
We had our son, so we got the daughter, so we got the pigeon pair. Yeah, and we were both delighted and thought, how good can life be?
Shannon has had 15 brain operations and chemotherapy so intense it caused her to go deaf. It began when Shannon was just 3. She was diagnosed with rare malignant brain tumours.
Never in your wildest dreams could you imagine something so awful happening to one of your children.
Shannon has a rare childhood cancer called ependymoma. Tumours that keep coming back even after chemotherapy and surgery.
The surgeon that she had at the time wasn't trying to remove all of the tumour because, in his opinion anyway, it couldn't be removed. And we were basically told to take her home and enjoy her for 6 months. I went into shock. I remember putting my face in my hands and just rocking back and forth and saying, this can't be happening, this can't be happening. It couldn't be happening to her, no way. No.
It was just like you're in a movie and it's going to finish in a couple of minutes and go away. But it didn't.
But like any parents, Danielle and Colin wouldn't give up.
When it's your own child, you have to keep looking, you have to keep going. And we were prepared to do whatever it took to save her life.
So they went to Dr Charlie Tio.
Her last chance at life was certainly surgery then.
We were told that it was inoperable. You couldn't get it out. And Charlie said, I can get this out. He said it might take 2 surgeries, but I can get it out, and I'm very confident that I can get it out.
And he did what he could to get them out, over and over again.
If anyone is going to die, and die rapidly, it should have been Shannon. And she really should have died probably within about a year or 2 years of diagnosis.
In 6 years, Shannon has had 10 operations with Dr Tio. He has removed more than 50 tumours. But now the news her parents always dread. There are new tumours. So tiny Shannon needs Dr Tio to work his magic. Yet again. Operation number 16.
Now, you know, tomorrow we're going to go and see Charlie, okay? You know he's going to talk about the surgery.
Yeah, I know.
Just like Charlie, I'll give you lots of kisses.
Yeah.
Now I'll go to bed.
This is our last hope. We've got nothing else up our sleeve.
For 12 months, Kimberly had been waiting for new lungs.
When we go shopping, somebody has to push me in a wheelchair because I can't walk that far. I struggle to walk to the letterbox. I struggle showering myself. My husband has to wash my hair. I can't do the washing. I can't cook dinner. Just the standing up, the effort is just too much.
80% of her lungs didn't work because of a genetic condition, cystic fibrosis. To stay alive, Kimberly was relying on constant oxygen.
Everyone counts on time, and when I'm just waiting, and it's waiting for my new life, you don't know when it's coming. And I hang on for this magic day when this phone rings, and it just, when is it coming? When?
Finally, the call came, and Kimberly went through the operation to remove her old, damaged lungs and put in new, donated organs. The surgery went well, and now, 3 days since her transplant, Kimberly is already getting back to her bright, bubbly self.
Just feels so surreal, doesn't it?
Yeah.
It's just, I think it'll take a while to sink in.
You didn't believe that this was going to happen.
No.
I know.
I didn't think that
Last time I saw you, I know you were thinking, it's not going to happen. It's never going to happen.
Yeah.
Yeah.
Oh, yeah.
Yeah. But somebody made a very good decision,
Yeah.
you know, to let somebody they love become an organ donor.
Yeah.
And that means that you've got a chance.
Yeah. And I'm going to take it with both hands, and I'm going to
I know
run
you
with it. I am. I certainly am.
Okay.
Kimberly is not out of the woods. There's still the chance her body will reject the new lungs. Her first real test will be physiotherapy, her first walk since surgery. Claudius has travelled thousands of kilometres for his last chance surgery in Sydney.
My wife and my family, we are normal, simple Solomon Island family.
Away from his wife and children, he has the assistance of the consul for the Solomon Islands, Trevor Garland. Claudius has come to Sydney for a highly specialised operation. Claudius is going blind.
So, can you see anything on the chart up there?
No, it's all blur.
Claudius is already blind in his left eye.
This eye is the worst one, doctor, on the left.
His right eye will also become useless without surgery.
Well, we've looked at all your tests, and if you see here this enlarged white area, this is the tumour, and the tumour grows upward and puts pressure on the eye nerves. Here you can see the pituitary gland at the bottom of the brain, and that's the one where the growth is occurring on. So you understand the reason for doing the surgery. If we don't do the operation, you would go blind.
But Claudius is about to learn it's not just his eyesight at risk. The tumour is in his pituitary gland at the base of the brain. It will keep growing and Claudius will not survive.
If left unchecked, he would have got complications of swelling in the fluid passages, and he would lapse into a coma and die.
But even the operation has its risks. Neurosurgeon Dr Malcolm Pell wants to remove the tumour through the nose. An ENT specialist will clear the way, cutting into the back wall of the nose. Then Dr Pell can remove it piece by piece. But in that tiny area at the base of the brain are many vital structures.
Still a risk of bleeding, damage to major vessels, which could cause a stroke, damage to other nerves, which could cause other problems.
And then there's the risk to Claudius's already damaged vision.
With the vision, which is your major problem, there's a 50% chance of it getting better, but you have to be aware that it could get worse and the little vision you have may go. That happens in about 5%, all right? But if we don't do it, it'll go by itself, all right? So it's necessary to do.
So with surgery, he could lose his sight. But without the surgery, he will go blind and lose his life. So Claudius has little choice.
You know, there's no other way. There's no other way. St. Vincent and the treatment I'm in the process to do here is the only way for me. And I know the risk is there, the doctors are saying, but I'm very confident with prayers And I'm confident, that they would help me.
6 days ago, Kimberly was given a second chance at life. New lungs. Her old ones were destroyed by cystic fibrosis.
Shall we see what you like on your feet and then try a few stairs?
Before the transplant, Kimberly was on constant oxygen. Now she's facing her first real test since the operation to see how well her lungs are performing at this early stage.
How many do I have to do?
10 would be fine.
Okay. A really weird sensation. I've got a lot of fluid in my legs and it feels like I was lifting up sandbags, and I haven't walked stairs like that for a long time. Before at home, I could struggle through 5 at a max.
She did really well. She would be classified as being independent now. I was basically holding on to Kim because she'd done stairs for the first time after a long time. But her legs were strong and she did that very well.
I didn't expect to be able to do that so soon at all. Yeah, it's pretty sensational. It's still very surreal though. It doesn't feel real. It feels like I'm living a bit of a dream, an amazing dream. This is not just a normal hospital admission. I have new lungs. I have a new life.
9-year-old Shannon knows Dr Charlie Tio very well.
Hey, gorgeous girl. You gonna give me a kiss?
Oh, what are you going to show me?
Please? But I'll steal in the game later.
She wants to show you something.
What have you got there?
Since she was 3 years of age, Shannon has endured 15 operations. Dr Tio has performed 10 of them. He had to operate over and over again to give Shannon a longer life. Now Shannon needs surgery, yet again. Shannon now has at least 7 tumours. They have spread along her brain in the pathways that supply fluid for the brain and the spinal cord. If not treated aggressively, any one of the tumours could kill her.
She's got rapid recurrence. She has kind of failed chemotherapy, and there's really no other option. So we can count about 7 on there, but as you know from last time, I forget how many there were last time, but I think there were 27 last time or something.
That's a lot.
So I think we're going to find that there's probably more in there when we get in there. But there's 7 big ones. Given that they're all getting bigger and there's a new one, I think time is of the essence. If we're going to do something, we really need to do it pretty quickly. I think surgery is our only option now, and we've got to go for it.
Claudius is going blind. He has come from the Solomon Islands with the assistance of Consul Trevor Garland to have a large pituitary tumour removed. The stakes are high. If he doesn't have the operation, the tumour will keep growing and he will die.
This patient has a pituitary tumour. You can see the white area here, quite a large tumour, and he's almost blind.
To take the tumour out through Claudius's nose, ENT specialist Dr Richard Harvey first clears the path to the tumour.
We're actually cutting away the normal sinus drainage pathways in order to get ourselves to where we want to go. This is really stuff that wasn't even contemplated only 10 years ago. As you can see here, we're coming right up to the tumour, and we're actually now sitting directly in front of the tumour. This area up here is actually our tumour mass there. It's a great picture now where we can see the carotid artery over here and the optic nerve. So this mound here is the carotid artery. It's one of the major vessels that heads into the brain. Up the top there's a white streak at about 1 o'clock now. That is the optic nerve. It's the nerve to the eye. All these structures are very, very close. And this little mound here is actually a little bit of tumour pooching through into this sinus.
Shannon has already had 15 operations to remove tumours in her brain. But the one Dr Charlie Tio is proposing now is by far the most difficult.
This operation that I'm planning to do on Shannon is a little bit more unique than the other ones in that she has never had a tumour in the 4th ventricle.
The ventricles contain fluid for the brain and spinal cord. And Shannon has tumours in both the 3rd and 4th ventricles. Dangerous territory.
Do you expect this surgery to go as smoothly as the others?
No, I don't, I didn't want to bring that up, but Yes, we've been very lucky with the others. I mean, to take out 27 tumours from a kid and have her out of hospital the next day is, you know, it's almost miraculous. So I think we've been blessed. You know, I'd love to take all the credit, but a lot of it's luck.
Yeah.
And again, I hate to say it, but, you know, one day luck is going to, you know, run out. Hopefully it won't be tomorrow, but it's something that we need to actually talk about, and that is that I'm going into two areas that are very, very eloquent, and there is absolutely a chance of devastating outcome from both of those things. Neurosurgery is one of those terrible specialties that is totally unforgiving. One small error, one small circumstance, one small anatomical variation, and you can kill a patient.
It's just 1 minute after the next, and it's just one day after the next, and you just keep moving forward. You have to.
No.
You're getting cranky. You don't want to have surgery.
No.
I know. I know. We have to do what we have to do. To her, it's just going to the hospital, get the tumour out, get Charlie to get the tumours out, and she comes back home and gets on with things. But for Colin and I, it's completely different because we worry that something will happen that shouldn't happen. And it's always a worry, and it's always there.
So you're looking for that golden answer that, yeah, everything will be fine, but it's very hard.
Okay, rightio. Get out of here. We'll see you tomorrow.
All right, thanks, Charlie.
No worries, son. Good to see you. See you. Same old, same old. Good to see you again.
Good to see you, but not so good to see you.
Give us a kiss, come on. Come on. On this particular occasion, things look even worse for Shannon, and there's really no other option. You either accept death now or you offer her a last chance of surgery.
Claudius is halfway through an operation to get rid of a tumour that is sending him blind, and if it keeps growing, will kill him. The ear, nose and throat surgeon has cleared the way to the tumour.
So here we go now. We're almost going to touch, according to the brain lab, we're almost into the actual tumour itself. So really, this is a massive, massive tumour as far as pituitary adenomas go.
Now the neurosurgeon will start to get the tumour out through Claudius's nose.
If you look now, this is tumour coming out. There's the curate now going into the tumour itself.
So this tumour is so big, correct, Dr Pell, that, I mean, it's very soft, this one.
Very soft. Yeah, there should already be pressure off the optic nerves. The capsule of the tumour will still be there, but as long as it's collapsed down, the pressure's off the nerves.
The last parts of the tumour are the trickiest, deep in Claudius's brain.
You can damage the major vessels or the nerves, and the patient could have a stroke or go blind. And if you get a fluid leak, you can end up with a meningitis.
Finally, the tumour is gone.
What we're seeing is the empty tumour cavity, where the bulk of the tumour has been removed.
Dr Pell is optimistic Claudius will at least get some of his eyesight back.
And we'll know when he recovers from the anaesthetic whether there's been an improvement in his vision.
It's just 7 days since Kimberly's lung transplant.
Good morning.
Hi, Dr Glanville.
How are you feeling today?
Good, really good, yeah.
And tell me what you did yesterday.
Yesterday we walked with the physio and I went up 2 flights of stairs, 10 stairs each.
Excellent.
So, and I haven't done that for I can't tell you how long, and it was a pretty cool feeling.
Good.
Yeah.
I think we should remember that a week ago she was on oxygen 24 hours a day. She was virtually confined to a wheelchair. Everything that she did, from brushing her hair to getting changed, putting her clothes on, was a real struggle. And now she's beginning to see that she can exercise and do the regular things of everyday life without any problems at all.
It's just it's amazing how instantaneous it is, and it's just, now it's about getting your mind in the right spot.
Exactly.
Yeah.
And this is only the beginning. Think of all the things you will do in the next year.
It will get so much easier too.
Yeah, it will.
Yeah.
It will.
It's just taking the jump now and believing that I can do it.
So how would you like to sleep at home?
Oh, I'd love to sleep at home.
Well, I think we can get you home today.
That's wonderful news.
Yeah.
That's great.
Her transplant, in effect, is just the beginning for the rest of her life.
This is the most amazing feeling. I am beside myself and I am so ready to start the rest of our lives. I feel really goofy at the moment. Just, this is so exciting. So exciting.
Next week, tearful goodbyes as tiny Shannon faces operation number 16, the most difficult yet.
Unfortunately, these tumours are in a more dangerous area. They're bigger, they're nastier.
And Claudius's life is saved, but has he recovered his sight?
Can you see me out of that eye? Can you see anything? Can you see me?